We're going to go ahead and get started. We appreciate everyone coming again. Thank you very much for your attention to this committee's needs. I know you have several of you are probably jumping around from other committees as well, so we appreciate the earnestness with which you're pursuing the issues of trying to provide better child care and ensuring that the state is doing a more than adequate job of supervising the needs of children that unfortunately wind up in state care from time to time. Also, we appreciate the agencies working with us diligently and the communication that we've had back and forth. What I'd like to do at this time is just give you a little bit of the overview of what I'd like to see us do this morning. And then the first thing on the agenda is I do want to take some time just to give a moment of silence for Truett Cathy. After that, I'd like to just have a free-flow dialogue between the committee members and everyone that's here today that would like to talk. We have tried to get out a rough draft first shot at recommendations, which we have revised that slightly this morning, and Jamie has copies of those. If you don't have a copy of them, I think she has copies of the corner here. And we'll go through those items, and I really want to just kind of touch on items number by number, paragraph by paragraph. Together Georgia has submitted a lengthy analysis as well. The agency, DHS, and DFACS and DJJ have submitted some information. I believe Raquel and Carl, you'll have additional information for us this morning, so we want to hear that. But I'd like to just kind of walk through all these issues and start to coalesce these items into a narrative that we can present for a vote at our next meeting as a list of recommendations from the committee. And again, it's a privilege to serve with the members of the committee. We have outstanding committee members, wide-ranging in terms of their skills, expertise, and background. And it's certainly a privilege. Chairman Weldon will be here shortly. He has a meeting with Lieutenant Governor, and he'll be in a little later. The first, after our moment of silence for Mr. Cathy, I wanted to also allow for Ms. Mabel Gibson to talk to us a little bit about the Kenny A program. So I thought we'd get some information on that quickly, 5-10 minutes maybe, to discuss that so the committee is aware of the special issues that must be addressed under that particular consent order. All right, with that, if you would, I'd just like to read something for you concerning Mr. Cathy. I think we all know that he passed away earlier this morning. And just a quote from his book, Eat More Chicken, Inspire More People. And this is him writing, nearly every moment of every day we have the opportunity to give something to someone else. Our time, our love, our resources. I've always found more joy in giving when I did not expect anything in return. How true are those words for a lot of what the many organizations here do. We have a thankless job. The agencies have a thankless job. The Wind Shape Home program that's started by Mr. Cathy has foster care homes in Georgia, Tennessee, and Alabama. It's impressive to see what a man born out of poverty through the Great Depression was able to accomplish in this country. And I think that's a unique, seems to be a unique phenomenon across the world to have such a great, I think, leap from the lowest levels in society all the way to the highest levels in society, and to do that with a core set of principles, as a tribute to him and to our country. And if you would, I'd like to ask for just a few moments of silence to remember him and the efforts that his family has put forward for the children of the state of Georgia. If you would. Thank you. Thank you, Mr. Cathy. With that, Ms. Morgan, if you would, Ms. Gibson, would you come forward and we'll have you just talk to us about the Kenny A program briefly, and then we'll start our discussion about recommendations. Good morning. Let me turn that mic on. Let's try it now.
Good morning.
There we go. All right. Thank you. I'm sorry about that.
No problem. My name is Mabel Gibson, and I am the Section Director for the Kenny A. Consent Decree with State Office. This got started back in 2002 when CRI filed a lawsuit against the state of Georgia. Children's Rights Incorporated. Okay, sorry about that. They also looked at the largest two counties, which at that time were Fulton and DeKalb, and they said that they were the most egregious. And what they indicated is that we were basically breaking some of the civil rights of the children in care. We were keeping kids in care much too long, and we were not providing them with their basic needs. So under this consent decree, they have come up with an agreement of 31 outcomes. Two of the outcomes were one-time measures, which we are no longer accounted for. There are left 29 for us to have to meet. Of the 29, we have achieved 17 of the outcomes. We're substantially in compliance with 9 of the outcomes. That means that we're within 10% of meeting those outcomes. And we have a total of 5 that we have totally not been able to achieve. The outcomes are broken down into safety, permanency, well-being, and strengthening of the infrastructure. I've passed out a handout which shows you the grid as to exactly where we are. Consent decree outcomes 1, 2, and 3 has to do with our investigations of our maltreatment in care. As you can see, we are working on those, but we really have some work to do with our safety outcomes. Also, 5 and 6 are related to substantiated maltreatment and corporal punishment. Permanency outcomes includes outcomes 7, 16, 19, which is related to children keeping their connections with their family and their community while they are actually in placement. The outcomes to 21 and 23 relates to visitation among the family members. It's very important that they maintain those visitations with their siblings and with their parents while in care. 3, children achieving permanency. Outcomes 4 and 14 are related to reentry. Reentry into care is something that we're really trying to work on. A lot of that has to do with children, with our teenagers, and with children who have a lot of needs, including mental health needs that we are trying to take care of. Also, in the permanency field with children achieving permanency, we're looking at outcomes 8, 8B, 9, 10, 11, 12, 13, and 15, and that's related to the positive permanency exits in which we want for our children. Consent decree outcomes 27 and 28 are related to timely and complete court orders and reviews of those permanency efforts. We have to make sure that those efforts are in place within 60 days to make sure that we are trying to get that court order, that wording right in the court orders. That's all very, very important. Well-being consists of children experiencing stable placements and worker continuity. Consent decree outcome 17 is related to placement stability. We don't want our children moving from placement to placement, and that is something that we definitely are trying to prevent. Consent decree outcomes 18, 20, and 22 relates to worker continuity and contacts with children and caregivers. The more you change workers with our children, the longer it takes for them to get adjusted to workers and to actually the goals that they have set, where they're working closely with their workers. So that is something that we definitely try to prevent. Consent decree 18, 20, 22, no, that's the one, I'm sorry, I just covered. Outcomes 24 has to do with the educational achievements of our youth who age out of foster care. That is something that we're definitely working on, trying to improve that outcome. That outcome actually is higher than the national outcome. So that is something that we are definitely wanting to renegotiate at the time when it's most applicable for us to go back to court to renegotiate. Consent decree outcomes 30 relates to meeting children's service needs. That's their health needs, their mental health needs, their medical needs, all of those needs that our children need that we want to ensure that they get and that they get in a timely manner. And the last part of this consent decree has to do with outcomes, effective oversight and placement of placement settings. The consent decree outcomes 25 and 31 is related to your placement setting and the conditions of those placement settings. And that's one of the reasons that we're here today to talk about some of the oversight that's provided by RCC, Residential Child Care, and the Office of Provider Management. That is something that the Kenny A monitors, there are two that are in place, Jim Demas and also Karen Baines Dunning. They're the court monitors that are currently over the consent decree. And one of the things that they have gotten used to is OPM going in there doing those unannounced safety visits. And they really focus on that. They look at that because they are unannounced. That's very, very important to them. And they basically would like to see those safety reviews continue. And our last but not least, the timely and complete court orders. A lot of this has been taken care of with the new juvenile court requirements, but to make sure that those children remain in our custody with those custody lapses, which is now prevented because of the new things that we have in place. Some of the things that we have in place to ensure that we are doing a better job with the Kenny A is that we have our match practice system with our SHINES data integrity. That was a big problem for us when we initially started the consent decree because we did not have a SACWIS system, a statewide automated system for DFACs. We now have that in place, and it is called SHINES, and we're able to get information, we're able to draw data from that system in order to accurately report. We are using research to guide some of the strategy development that we have. We're using execution, we're using communication, we're partnering. We have what's called G2 meetings on a monthly basis where we come in and we talk about some of the strategies in which we are exploring and we're using in regions 14 and 15 to ensure that we are meeting the requirements of the consent decree of these 29 that are left for us to meet. We also are partnering with our partners. We've also been asking our providers to come to those meetings and to be a part of those meetings, and we really appreciate them coming in and being a part of that. Sometimes they have solutions to things that we have not quite come up with the solution for. We also have statewide training. One of the things that we have to depend on is not just work that's done by Fulton and DeKalb counties, but also some of the perimeter counties, because we have so many foster homes that are in perimeter counties, such as Henry County, Clayton County, Gwinnett County. So some of those perimeter counties, we do have foster homes, and those are our CPA foster homes, and we really depend on them for placement of our children. If you will look at the grid that I passed out to you, you will see exactly where we are. As I indicated, we have 5 that we've not been able to achieve, and most of those are our safety ones. Outcomes 1, 3, outcome 9, outcome 10, and 11 are the ones that we've not been able to achieve. We do have strategies in place for those that we are working in order to meet those outcomes. As you can see, we have only 9 that we have been able to reach within 10% of our goal. We've made some strides. Even on some of those that we have made strides on, we've actually reached, but with some of the slips, we've slipped in some of those areas. But if you look at the majority, 17.
I'm sorry.
Yes.
Skips. I wrote down 1, 3, 9, 10, and 11 as being non-compliant. Is that? But I'm seeing
1, 3, 9,
9.
10, and 11.
Okay. I just want to make sure I have the numbers right.
Okay. Yes.
Thank you.
Yes. Okay. And 17 we have achieved. So we have come a long way, and we also know that we have a lot of work to do. We work diligently at state office with Region 14 and with the perimeter counties in making sure that we are meeting those response times, and we're getting out there within the time frame required to get out there and to assess safety for our children, and that we are seeing our children face to face, which is outcome 3. And we have come a long way. We actually did better in outcome 2 than we have in a while, and that means that we are actually getting those investigations completed within 30 days as required by KENEA. Another outcome that we really did a lot better in this time was outcome 30. And if you look on next, probably your last page, you'll see that we came from 73% in period 15 to 81% in period 81. Are there any questions?
You have several. Representative Oliver.
Mr. Chairman, did you have a specific reason you wanted this presentation?
Yes, ma'am. There are, DHS brought it to my attention that because of the items, I think it was Ms. Gibson that noted, item 31 that deals with the 10% of children in foster homes should be placed in foster homes that exceed the capacity limits. And if I wrote down correctly, I think 17 was the other one. If that, I may not have gotten the number correctly in terms of these consent orders. And that's the fewer moves, but there were two paragraphs or 2 numbered consent order decree requirements that have to be met. I think 31 was one of them. What was the other one?
Yes, and I believe do 17 and 25.
And 25, okay.
Yes.
And in those deal with the oversight that RCC, I think, has in terms of these particular, and correct me if I'm wrong, but that's my understanding was that they have a couple of issues, and there was some concern that whatever recommendations that this body made needed to be informed with respect to DeKalb and Fulton County and the KENEA consent order. So that's why I wanted to make sure that this information was before the committee.
This is an important case to me, and I met with the commissioner and probably several of you. I don't remember how long ago, 6 months ago or something like that. And I don't want to take the committee's time about this right now, but for those of us that are on the Appropriations Committee, I've done a FOIA on the cost of this, the cost of the monitors, the cost of the data collection, the cost of all going to private providers for only 2 counties of the state, where 157 counties are not, children in those counties are not getting these services. And I'm really interested in your exit strategy. You say that you are going to seek removal from the consent order by 2015, but I don't believe the state has filed anything in preparation for such a motion, have you?
No, ma'am, we have not. In our last exit meeting with CRI, which was back about a month ago, that was something that was brought up by our attorney, Mark Cohen, at some point that we want to look at going back to renegotiate some of these items. And CRI was okay with that and indicated that, once we show that we are really working on this and we are, well, they know that we're working extremely hard, but also they want to see us do better in some of the safety outcomes. And then at that time, and also bring up some of the ones that we're in substantial compliance with, that at some point they would agree to going back to court with this.
Mr. Chairman, I'm working on this in terms of some appropriations figures that may be of interest to the committee, and I'm happy to report to you later on that, because this case needs to be brought to an end.
Yes, ma'am.
Thank you, Representative Oliver. Representative Tanner?
Just a couple of quick questions. Number 3, did I understand that correctly? What that's referring to is if there's a report of abuse or neglect, actually having someone from your office meet with the victim face-to-face?
Yes, sir, that is exactly correct.
Okay. And then second thing was this agreement was, is it 2002? Was that correct? Is when this was?
It started in 2002. The actual agreement took place in 2005, I believe.
Does the agency do anything? I know this is specific to DeKalb and Fulton, but for the rest of the state, do you all monitor these same similar issues relating to how quickly you're responding to a report of abuse or neglect? And
Yes, we do. There's actually a report in Shines that can tell us the response time for every county in the state of Georgia.
is that something that I would be curious to see that and how that relates to what's happening in this report? Is that possible to get a copy of that?
I'm sure it is.
Okay, I'd like to see that if we could get that.
Okay.
Thank you.
Representative Tanner, thank you very much. I'd like to just follow up because I'm looking at the one of your pages in your PowerPoint presentation. It's and unfortunately they're not numbered, so I can't tell you. But it's titled Kenny A Project Strategies. It's well within towards the back of your.
Yes.
It's just before the slide. How are we doing? And it just says match practice with system evolution, and this is the Shines data integrity. To follow up on what Representative Tanner was saying, can you explain to us in more detail what the Shines database does exactly, and how is it interlinked? Is it just within Fulton and DeKalb, or is it across the state? And if it is across the state, what information is collected, and who has access to that information?
That is across the state, and everyone within DFACS has access to that information. There are so many different reports that you can get out of that. Your Every Child Every Month visits, your response times, the number of cases that you get in as far as investigations, the number of cases that have been closed, your pending reports and for investigations, your overdue pending cases for investigations, your family preservation numbers, your family support numbers. It's everything that we can basically report out on that we need to manage our work. Supervisors can use those reports. All of the information that's put into Shines, you're able to get reports on a lot of information through the data system.
Does it include the inspection reports done by individual caseworkers?
The investigations?
Investigations?
Yes.
Okay, let me break it down so I understand. An investigation is that a complaint-driven initiative, or is that just a unscheduled visit to investigate?
Everything. The reports are in there.
Mm-hmm.
Everything that the case manager does when they go out, all their documentation, everything is in the system.
Okay. Does it include inspections done by RCC?
I don't think so. No,
That
stuff is in Georgia Score, I believe.
We have read rights.
Right.
Okay.
Right.
Can your agents in RCC view Georgia Shines?
Yes, we have read rights.
Read rights, so you can read.
Yes.
But do you have the right? Do you have the ability to write into their system? No. So it's read only.
Yes.
Okay. So read rights means the right to read it. Okay. Right. Just make sure what the right
Correct.
with the W. Okay. And then the other is Now, what about DJJ? No, Shines.
No, they don't have access.
You have no read rights?
No.
Okay. All right. And then, so DJJ cannot view what the reports for Georgia Shines?
No.
Okay. All right. And how is it, if you're able to read, but you're not able to report, so you're not able to communicate through that one database of Shines, RCC is not able to communicate any of its inspection information in the Georgia Shines database. Is that correct?
Correct.
Ms. Winstead?
Correct. Basically, what my surveyors use it for is when there is an investigation that they're assigned to investigate, they look in Georgia Shines to find out more details about what has been done already, because DFACS is the first responder, so more than likely DFACS has already been out to initiate the investigation. So my surveyor looks at the additional information that's been obtained before they go out, and then at the end they also use it to find out the findings of the DFACS investigation, whether it was substantiated or not substantiated.
Okay. And when Ms. Gibson, when we're talking about DFACS, are we also talking about OPM, or is that?
OPM does have access to our system.
Is that
As far as for reviewing it, I don't know if you all do any documentation in the system, but I do. Yeah.
And this is Ms. Stokes-Bryan?
Yes.
Yes, welcome.
And just to clarify, it's not, and just to clarify, I don't want to lose sight of the fact that this is a child data reporting system. So it's not just about the investigation, but it's about foster homes, the child's information, foster parents' information, placement information. So it's just not about investigations and reporting. This is the data system that's used for the children that are placed in DFACS custody, as well as the foster parents that are working with these children.
Is there any, okay, so, but OPM has an ability to read this information.
Yes, yes.
Does OPM have any ability to write in information to the program software, or?
We've never had someone.
No, what we're missing with Shines is the ability to upload our but our monitoring reports for each provider. We can't upload those reports to each provider. We can add information to the foster home records, but there's just no way for us to upload the reports. And so we keep the reports in the Georgia Score database, which RCC and DJJ have access to, so they can read our monitoring report.
Would that be of any assistance in monitoring the safety and well-being of the children in the system, to have access to and to be able to report data into into the Shines program?
It would be helpful to be able to upload our reports into Georgia Shines.
Okay.
And that is a part of our enhancements plan. But if there's something you can do to help us with that.
Enhance the enhancements? Yes, okay.
But I don't know that it will also give you what you're talking about from a well-rounded perspective with the DJJ and RCC. So it will allow OPM to do that. But if you're still looking for somewhere where you can locate all the information, again, you're still left with the DJJ and RCC concern with being able to upload their documents there where you can see everything.
Okay. So let me just make sure I'm clear. So would having an ability to input your individual inspection reports into Shines, would that be beneficial to each and every agency?
Well, it would probably be better if RCC and DJJ uploaded to Georgia Score, because we don't have the same restrictions with Georgia Score. Georgia Score is a contract management system, whereas Shines is a case management system. DJJ has their own case management system. DFACS has its own case management system. I think you're going to run into more barriers if you try to use Shines, but Score is already built to manage contracts. Our reports are there. Everyone else has access to it. They could literally upload reports today if they wanted to.
Okay.
We created that for them. So that's probably the easiest way to get to what you're trying to get to.
Okay. Thank you. All right. I'm sorry I monopolized. Let me let Representative Oliver.
This is a helpful discussion, but I agree with this lady. I'm sorry I don't know your name. That we've confused a little bit the child-based data system, which is the SHINE system, with the institutional-based system, which is the SCORE system. And DJJ and DHS have different histories. DHS had a totally privatized development, and Accenture's paid $6 million a year now to maintain that, whereas DJJ contracted with Georgia Tech to develop your database system. And so if I were in charge, I would go back to Georgia Tech and say, please create a data system that deals with combining institutional data reports, and try to make it somewhere user-friendly between these systems that we exist. But asking the SHINE's people to do it is the most expensive way to do it because of Accenture's $6 million contract a year. I'm interested in all this, Mr. Chairman. It's important, but I think the Georgia Tech, if I'm correct about that history of your database, may be a more useful institutional-based system that combines the information.
I think that's, we've been meeting for lengthy periods of time over the past month, and I think that we are hearing a need for some centralized database to enable all the agencies to communicate better. And I agree with Representative Oliver. We want to do that in the most cost-effective manner because the recommendations that come out need to be cost-sensitive in the sense that we don't need just to utilize a system that may be very expensive to modify when we could modify and maybe use Georgia SCORE as an alternative. But I appreciate that history because I think that's important for us to know in making those recommendations. And it may cause us to have more generalized recommendations as opposed to any specific ones. There were a couple of any other questions regarding Kenny A. From the committee. Okay, good. Thank you very much, Ms. Gibson. If you don't mind just joining us for a little while longer, if you can. If you have to go to a meeting, that's fine, but you have a lot of knowledge in this area and it may be helpful. What I'd like to do is, I know that Ms. Stokes-Bryan, just stay right there. Okay. I don't think you. I would feel more comfortable if you didn't move around too much. You okay? Okay. What I'd like to do is, there was Representative Oliver, Representative Tanner, Representative Chandler, and Representative Housen all had very specific questions at our last meeting. So Ms. Fielding, I know, had put together some responses to those. What I think would be helpful at this point is to try to let someone from DHS try to address some of the specific questions that were raised. I think Representative Oliver had a concern. Everybody seemed to have a concern about the criminal background checks that are done and how we can try to address that. That was one of the issues, trying to create some uniformity with that. And we've been presented with a letter from, and it should be, the committee members should have that with you, from the Georgia Bureau of Investigations, dated August 22nd, 2014. If we could talk, Ms. Kennedy, if we could talk a little bit about that, I think that would be helpful. And then there were some additional questions. Ms. Representative Oliver had some questions about the DJJ children, and I'll have to ask her to refresh all of our memories on. It dealt with a number of children that were in the system. I think that I think overlapped between DJJ and had some criminal history, and then the impact on the RCC numbers. But I'll let her restate that. And then there are other questions, I think, from other members. I just want to make sure we tackle those questions and get those addressed promptly, and then look at these recommendations thereafter. So could someone speak to the GBI letter we have received? Ms. Fielding or Ms. Kennedy? This is the August 22nd letter. This is dealing with trying to create a uniform criminal background check.
We have, okay, if I stand here.
It should be on.
We have had a conversation with GBI regarding whether or not we would be able to share information across agencies. In the letter you see before you, DBHDD is cited specifically, but we have been told that they were just sharing that as an example of an agency. But basically, the FBI, according to the letter, is empowered to exchange identification records with officials of state and local governments for purposes of licensing and employment if authorized by a state statute. The standards employed by the FBI have been established by a series of memoranda, but the particular one is publication L92-544. It prohibits the results of record checks being released outside of the receiving governmental department or related governmental agency. And the FBI defines related agency as a legal principle providing for the redissemination of CHRI by an authorized recipient. Agencies that have a commonality of purpose and typically congruent responsibility authorized by federal statute or executive order or approved state statute can receive CHRI and exchange that information with each other for the authorized purpose originally requested. They must have a unity of purpose and typically concurrent regulatory responsibility.
Love all that legal language. Frankly, it sounds like to me that this is very much a possibility, but what we need is state law making that, stating that these various agencies that have some overlapping responsibilities, we just need to spell that out in state law. And then, if I'm hearing you correctly and reading this correctly, is that a fair statement?
Pamela, I'm going to defer to you on that one.
We always like to hear from our attorneys.
Well, I can tell you that I know in the past when this issue has come up that whole statement concerning that the records cannot be disseminated outside the receiving departments, related agencies, or other authorized entities. I know there was some discussion about what related agencies, what that meant, and so I don't have a clear idea as to how they actually describe that. So I think that would be an issue for the GBI and FBI to make a determination regarding. So.
Counselor,
Sure.
Would it be possible for you to draft some language that would help bridge that gap and then have those discussions with GBI and FBI to see if that language would capture DJJ, DFACS, OPM, and RCC? And then I think that's all that we need to cover.
Well, what I will do, sir, is I will look into that. I will actually get back with my superiors and see and discuss that, and let Ashley know exactly what we can do in that area for you.
Because it sounds like that there is an opportunity in the language that's been quoted here. So I'd like to try to seize and take advantage of that. I think the members of the committee would like to make that. I think that's kind of a reverberating. A recommendation is to try to streamline that process. So once one of those background checks, and probably the most stringent, would then apply across the board. So once it's done for all agencies. All agencies have access to see that information. They can check the box to make sure that's been done.
Yeah.
I think that would be very helpful.
Okay. Yeah, because I do have a concern that, of course, the FBI authorizes such changes, and basically, I think that conversation with them is truly important, because basically we can have our services counseled if they're not in agreement. So I do think that's very.
And forgive me, but names and faces I'm not excellent with, so I'm still trying to work on that. But could you just let us everybody know that your name?
Oh, Pamela Carr-Cosby.
Ms. Cosby, yes. Ms. Carr-Cosby, thank you very much.
You're welcome.
And I will, we will circle back with you to try to coordinate those efforts. Is that all right with the committee?
Done this, Mr. Chairman, so I think there's some models out there that have gone at least somewhere down the road to make this combination work.
All right. I think that is one of our recommendations that we'd like to pursue fairly aggressively for the session. Okay. Thank you, Representative Oliver. Now, Representative Oliver, go ahead. You had specific questions regarding some numbers, and I want to go back to that and see if you got the answers to those questions.
John and I talked for a minute this morning, Mr. Smith, with DJJ. I was interested in the number of crossover children that y'all were managing, and then I was also interested in whether or not you had any data on the 470 abuse complaints that were floating in based on from institutions. But John said that y'all were still working on some of that, and I may have confused some of the questions.
So, Ms. Raquel, Mr. Brown, Ms. Williams, do you have that information? You're still working on it?
We're still working on it because currently how we capture the information, and there are not any incident numbers associated with the reports. So we're having to actually go into our regions to kind of pull that.
And I also think Chairman Willard and I were looking at those arrest issues and follow-up arrest issues.
Your time is up.
Yeah, time is up. That's good. That's good help.
I'm sorry, I'm kidding. Ms. Watson, when will you have the numbers? Do you think you'll have the numbers ready for the committee?
Will there be another meeting with Chairman?
Yes, we plan on having one final meeting to try to finalize our recommendations.
We would work diligently to have that prior to that next meeting.
I wouldn't expect the meeting to be any sooner than 2 weeks from now, but I'd like Representative Oliver to have and Representative Chairman Willard to have those numbers well in advance, so that they can review them and make comments back to the committee, because they're working diligently in this area, have a greater expertise than I do. So I'd like for them and the committee to have those numbers in advance.
Do what we can, sir.
Okay, thank you. Yes, sir.
Yeah, follow this, Chairman. I think numbers would be helpful, but more so is what can be done as far as putting into place some policies and procedures that call for communication coming up, so somebody can be aware that this is happening and step in and start trying to find ways to get this youth out of a detention facility, whatever it may be. They're not able to put up bonds, of course, and so if we need to do something addressing it in statute, we can do that, but I really look to the agency to find some ways of putting this policy in place, and let us know what your thoughts are on that.
Okay. Thank you, Mr. Chairman. Now, I'm trying to remember, Representative Tanner, did you have, there were some questions I think you had asked before, and I don't have them written down, but I want to make sure that we've covered them. If there were any questions you had outstanding that you wanted to get answers to today, I want to make sure those get addressed.
No, Mr. Chairman, I think that from conversations last meeting and after, I've got all my answers.
Okay. Thank you. Representative Chandler, did you have some questions that you had for us today? Or
referring to the discussions we've had, or anything else in the way of recommendations?
Any discussions that we've had that you feel like you need some additional information on that we can have before our next meeting? I want to make sure you get those today.
The only thing that I'd like to have is from the Windshape homes or some of these other homes like that. I'd like to know what you would recommend as far as how we might need. I keep hearing that we need to have a different system for you all, and I'm not sure, do we have representation from some of those organizations here? Yes. I'd like to hear your, I know we've heard from you, but I'd like to specifically know what you would like to see as far as a different system in place.
And Ron Scroggie is coming up to the microphone.
Thank
at
you,
the
Ron,
end.
and I'm sorry, I knew you.
And
Yep.
Ron, we appreciate what Together Georgia's put together for us, but I think it would be helpful just to kind of run through some of those items, especially where we've seen some overlap in what the committee is looking at in terms of what we've already sent out, and what DHS and DJJ have put together in their recommendations.
Yes, sir. Well, first of all, I would just want to thank you all. I think it's been a tremendous conversation we've been having. It's long overdue, having been 20-plus years in the private sector, working in the provider community, and then being state director of DFACS for the years I was. This is a conversation that's been around for a long time, so to have it to this depth and be having this conversation, I really am very appreciative of. I will tell you that Together Georgia has pledged itself to continue to work with DHR, DHS, DFACS, DJJ, all the agencies. We will continue to work with them with whatever recommendations come out of this committee. I can also tell you, I just want to say this as a kind of introduction. You know, when I was state director of DFACS, every child death in the state of Georgia came across my BlackBerry. I read it. I put it on my prayer list at my church every Sunday. I know what it's like to have to deal with safety in these children. And whatever the recommendations that we've been making, as well as the ones that finally come up, we do not want to compromise in any way child safety. So I just want to put that out there first. I hope you'll consider the legislation that we've given you. We think that's one opportunity. It may be too extensive, it may be too long of a process, but you know, one of the things that happened, I think, that is a root cause of some of the issues we have here is one time DHR had under its umbrella DJJ, DFACS, RCC, mental health. All those were one entity. And all this communication we're talking about, this data sharing we're talking about, all the stuff that you've been kind of quizzing us about was there. And once we split up all the departments into the individual areas, a lot of siloing occurred, and a lot of this sharing of information started out. So, you know, I think we've got to figure some way, whether it's the bill we're proposing or some other way of to share that information so that the young people and the providers and the agencies can all work better together. Regarding your specific question, you know, one of the recommendations we have is there, you know, this population of children that WindShape and Eagles Ranch and others take care of is a very small group of children that, in the scheme of things, that DFACS and DJJ work with. But when I was at DFACS, I wanted state children to be able to access those programs. And the fact of the matter that they didn't bothered me greatly, because I think they have a lot to offer for those children that could benefit from their programs. So the issue with those programs are the current standards, the way they're wrote up, they don't really address their type of program. They have a very family kind of go back into your thinking house parent type model. And the model, the way they're working their programs, operating their programs, don't fall very neatly into the categories that we currently have for group homes and foster parents. And thus the rules and regs don't oftentimes follow real neatly. Now, I can tell you that WindShape is having conversations right now with OPM and DFACS to have some conversation about what can and can't be within the current rules, be maybe looked at or thought of. So there may be some language there that can just be modified with the current, and maybe the interpretations changed. But also I'll tell you that our recommendation from the beginning has been perhaps there's a separate category created in RCC for this type program with appropriate rules and regulations stemming from those, as well as with OPM with the contracting rules, that those would be spelled out in such a way that those type programs could be monitored and overseen appropriately. So that would be my answer to that question. Anything else that I could do for you if I'm standing here?
No, I think just to answer some questions that Representative Oliver.
Mr. Chairman, do you want to talk about this draft legislation now, or would you rather do it at another time?
No, I think that why don't we go ahead and do that while Ron is at the mic. And Ron, let's talk specifically about the North Carolina legislation.
What I think we're talking about is this. Is this what we're talking about?
Yes.
Okay.
Stan, you want to come up? I'll get our lawyer up here too.
Okay.
Make sure we got the right.
I think it's this. Right,
the one that we sent in Friday last week.
Yes, this is it 5/9/2014? Is that
this? Yeah.
So there's a draft proposed legislation here that's dated 9/5/2014. Let's walk through this if we can. Thank you, Representative.
Would you like Mr.
It's a and just so if
Stan, would you like Stan to do it, or would you like us to just kind of talk through it? Stan, did you draft this?
Yes.
I think, Stan, if you'll walk through it section by section as swiftly as possible, but and then we'll allow the committee members to answer questions. Now, just so everyone knows, Jamie gave out to you this morning in your package. It says licensing and inspection of child care providers, September 8, 2014. It's a stapled package, and if you'll turn through the first 2 pages, then you'll have the third page begins Together Georgia's recommendations, and then after that, at page 4 is the draft legislation that Representative Oliver is referring to. Is everybody with us? Okay. Just want to make sure. All right. Thank you. Go ahead.
Well, thank you, Mr. Chairman. What we did is we took the legislation that's already been passed by North Carolina, which was an effort to get inspections and investigations combined, into an agency or commission or division that can concentrate on that, on things like the training to get interpretations central. A few states are trying to do this now. I think Florida's got some things similar to this. This is a first draft. I think everybody recognizes intensely the sort of differing responsibilities, in some levels for each of the agencies. So, there are federal statutes involved. There's budget money involved. There are different missions, and to some degree, the powers and authorities that are already in Georgia law for each of the agencies differ a little bit. But there are some general powers that are granted to each agency that are not as specific as the policies and rules and regulations. So one effort here is to try to get a process started that thinks about how to get the inspecting and contracting and investigation functions done together and done more centrally. Now, whether it's done through coordinated schedules, as the departments have been working on already, or done sort of in a more kind of instructed way from the General Assembly, that's something that we think needs some discussion. So there are basically 3 things in here. I'll sort of summarize them first, and then we can talk about more details. I did leave my reading glasses in the car, so I may miss an item or 2. But there are 3 things in here. So one is a DHS effort, DFACS, OPM, and RCC to think over the course of 2015 about things that can be done purely administratively. The second thing is trying to have a centralized investigating or inspecting agency, as that evolves over the course of a year or 2, that would work very hard on that. And this does contemplate that it would be a separate commission. It could be an attached agency. It could be done by contract. The legislation tries to authorize each of the departments to use its existing authority to delegate to or contract with a new entity to do some of these things together. So, and then the third thing that's in here is encouragement to use accreditation by the national accrediting bodies for some of the initial licensure and annual inspection activities for those agencies to use the accreditation as evidence that the providers satisfy the state law requirements. Now, that is already done. It's done in the Department of Community Health for hospitals. I haven't checked yet whether it's done for nursing homes. But if you are JCO accredited in a healthcare facility, that status can be used to substitute for some of the state standards and relieve some of the inspecting authority. It's mostly used in licensure. It's not used in investigations. It's not an issue relating to complaints. Everybody, as Ron said, believes that safety is the key issue. And so, but we're talking about things about licensure, initial inspections, with licensure and annual inspections. There's some things that we think could be coordinated better through the use of accreditation. It does say specifically, and I think this responds at least to some of the sentiment that Bobby Cagle's expressed, that we're talking about accreditation when the accreditation standard is higher than the state law standard. We're not talking across the board, and we're not talking about trying to apologize for agencies that may be regarded as bad actors, by any of the departments. But we're talking about there's some things that we think could be accomplished simpler. And there's also a provision here for studying situations like Windshape, Beagles Ranch, Goshen, if there is a new category of entity that's not a child placing agency or a child caring institution, but more like a parent, for them to have a different level, for that to be studied. So those are the things that are essentially in here. On the section 2, the first, it's on page
5.
I'm sorry. It says first a DHR task force, a DHS task force, excuse me.
Let me let the committee shoot questions at you as we go, because I think that'll be more effective. Representative Oliver.
This is very helpful beginning, and it's very timely in terms of having this discussion. Governor Deal has done an awful lot of reorganization by executive order, and I do not know what his plan is, assuming he's governor. Whoever's governor in January, what the plan might be about those executive orders. And that makes this discussion very helpful. It's also true that in looking at the future, which is not very far off, the Department of Aging supervision of license placements and Department of Behavioral Health supervision of license placing for adult mentally ill people is very much in transition right now. And as our somewhat impaired foster care children age 18 become 19 or leave Medicaid, we have a lot of reason to consolidate our licensing and oversight. So this is very, very timely discussion, and I want to support something like this. The governor's office would be helpful to me at whatever their timetable is, of course. What is the governor's plan about his executive orders and reorganizations? Whoever's governor.
Well, I think there are orders. There's also statutory pieces like the Juvenile Justice Coordinating Council have already got in place some activities to try to bring everybody to the table who's involved with a child who's in the custody of one department or the other. There's a wonderful interagency task force on children and youth that's been working for probably the last 2 years, maybe 2.5, and has done some things that didn't happen in DHR. I think it's one of the more interesting things. That's been a really remarkable set of cooperation among the departments on their own. But that there is a group that has responsibility, across all the departments involved, even broader than the council, that has done some admirable things already. But I mean, our recommendation is that it go a little further than voluntary task forces among the departments.
And I'm going to support that. I'm just trying to put it together with what an overall plan is.
Sure.
Can someone shed some light on why these different agencies were originally, you said originally they were under one roof. Now, why are they? I'm
laughing because I was 22 when that was recommended in 1972. So in my lifetime.
But you were lobbying then, right?
No, I was an employee.
Okay.
I think what's happened over time, some of it's sort of natural mission creep, I suppose is the nice way to say it, where the advocates and members of the General Assembly and the agencies who have narrower responsibilities feel like we can do that better, on our own basis. So voc rehab came out first, then juvenile justice, and then of course in the last couple of years public health and mental health have come out to be their own agencies. I would say, as an older student, that it kind of happens. I mean, if you look at state government over time, that you go like this with coordination and separation. And I think we're in a really interesting place right now because the departments on children and youth issues are working together better than they ever have. Mental health and corrections work together better. They're the forensic bodies when you get right down to it.
And the sharing of all those databases is available now to do more sharing.
Right.
It wasn't available during the first governor.
Well, you get focused on what much like SACWIS, for example, had to be done by Georgia, landed at DHS. So that's their statutory responsibility to go claim the federal dollars available for that. So you concentrate on getting it done. It's your job. You may not have time to pull everybody else in. I mean, that's what this is about.
All right. Representative Oliver, anything else? Okay. Representative Tanner? Oh.
Oh, it's me. Yeah.
I'm sorry, Representative Willett.
I just wanted to inquire, how many separate state agencies are we talking about that would be involved in discussions and proceeding what we may look at as far as these new rules and regulations or how it's to be done, Stan?
Well, this may not be a complete list. Over on page 6 in section 2, where we suggest the creation of a regulatory oversight commission. Let's see, we've listed DHS or DFACS, depending on mental behavioral health, juvenile justice, DCH, and education. And I don't know about DCAL myself, so I'm not sure I fully understand all of the functions they have. But this was an effort to list those who have responsibility for managing the partnerships with the
Yes,
private sector for children and youth. Now, education's in here.
Yeah. I was saying, how many different type of providers
Oh,
are we looking at? I'm asking both
question.
ways. Agencies now, how many different types and forms of providers are we looking at that need to be saying if there's a different way we do things and something needs to be recognized from our side?
I'll say how I think about that. I'm sure the departments may have different systems, but within DFACS, you've got child placing agencies and child caring institutions, and you have the two types of regulation: licensure and contracting. In Department of Community Health licenses psychiatric residential treatment facilities for children and adolescents. Now, that's a payment category. It does have a license as a specialized hospital. There are 7 or 8 of those statewide, but they do serve a huge number of kids in state custody with DFACS and kids who are either diverted by DJJ or coming out of incarceration. They are into community placements where appropriate.
Okay.
Then you have, I don't know what the right label is yet for Wind Shape, Eagles Ranch, Goshen.
There's a bunch, apparently.
Well, it's 5 to 8, I would say, maybe 6 or 7, something in that range.
Has there been any discussions from that group with the agencies to try and bring everyone together at one table to start dealing with that, or is that just still?
Well, for several years, we have had what's called a DFACS anyway, a leadership meeting where the provider community meets on a monthly basis. When I was director, and concurrently with Commissioner Cagle or Director Cagle, meet once a month, and we build an agenda and have these kind of conversations about the exact same things we're talking about here, as well as a lot of other things. That's just happening in DFACS.
Okay.
Also within DFACS, there is a system of care committee that primarily works within the departments. It doesn't really pull into the private providers too much.
Well, there is a governor's commission that's doing some of the same things we're talking about here, and some of us serve also on that commission. I would suggest that perhaps the governor can just make the declaration, agencies pull together, form a task force, and invite these other groups in to begin working through this issue one by one to come back with some recommendations. All I'm saying is, do we need to have legislation do it? We always do so much micromanagement through legislations. I just wonder if that's another reasonable way to do it.
I think it could be. Are you talking about the juvenile justice?
No,
group?
sir. I'm talking about the Governor's Commission on
Families and Children.
Family and Children's Services.
Yeah, okay. Sure. That is an option. Some of the accreditation issue is in statute at DCH. So, that's one thing that I think.
That would be a recommendation coming back from the task force is how to modify legislation.
That's true. I guess depends on whether you want to try to.
But you're not doing anything in here about modifying it, are you?
Yes, there is a provision in here that tracks the DCH statute on accreditation. Okay. It's permissive, but it is encouraging. It's sort of giving the authority to do that. I know some of the comments from DHS that said we're not authorized to do that right now.
I got you. Well, I hadn't read this, and we'll look at that.
So,
Thank you, Mr. Chairman.
Yes, sir, Mr. Chairman. Chairman Houston.
Let me see if I can understand this. You're suggesting having all these combined and do one and one
just the licensing and inspection, and
for all the same people that would do the ones for foster care would also do the ones for juvenile justice.
Well, it does need to be worked out. So, for the child care institutions in particular, maybe the CPAs also, DJJ and DHS are both using those providers intensely. They also use the PRTF's, psychiatric residential treatment facilities, that are licensed by DCA. So we're trying to talk about the things that are similar. We're not talking necessarily
That's what I'm
about
talking about.
everything.
But you just have one agency that would be responsible for doing the licensing and the inspection.
That's the suggestion, and it's a suggestion, and it's complicated. It involves budget authority, it involves employees. Separate.
But I mean, we're spending a lot on individual agencies doing this, so maybe if you put it all together, it wouldn't be so much a cost.
This is going more than coordinating the schedule for initial inspections or annual inspections. So that's how I would distinguish it from what's been said so far.
Let me ask a few questions about the proposal of using these accreditation entities. If you would, and I don't know that we need them right now, but I'd like to know more about them in particular. Who determines their standards, and to what extent does the state of Georgia have representation on any of these accredited agencies?
They're all large nonprofit, accrediting organizations. I know there's a council of providers and academics who contribute to the standards. I don't know the role that state agencies play. I'm sure there's not a Georgia-specific role unless there happens to be somebody who's on the council. So it's Joint Commission on Accreditation of Healthcare Organizations, the
COA,
Council on Accreditation, Commission on Accreditation of Rehabilitation Facilities. They're each sort of national think tank type.
The Council on Accreditation, the COA, the CARF, the Commission on Accreditation and Rehabilitation Facilities, the JCOA, I guess.
Yeah.
JCO.
They changed their name and made it harder to say.
And National Council on Quality Assurance, NCQA.
Right.
I have some concern about
Sure.
about the state moving away from the review and licensing and accreditation to these outside bodies that are not.
This does contemplate a determination by each agency or by this group, if it's formed, about whether the standards are in excess of the state law standards or the federal law standards for contracts or block grants that are administered. So it's not wholesale.
I see that here. You have it in there, that specific standards, that the more stringent of the standards ought to apply, and it gives discretion to the agencies to look at those standards.
Right. That's how it's set up in DCH. I took the DCH language for hospitals and tried to make it fit for the types of agencies we're talking about here.
Okay. All right. You want to run through Section 2 as quickly as you can?
Sure. The
Thanks, Stan.
5012-1 is just saying who should be members. It does include the Governor's Office of Families and Children. Section 2 sort of contemplates, analyzing the licensure, inspection, monitoring, and contracting oversight across all the departments. One of the sections is about inspection. The other section's about investigation, because there are different types of functions. And there's a provision in here that says, nothing limits the ability to inspect issues of abuse or neglect. Because I don't have my glasses, I can't do it as quickly as I'd like to.
12.5.
Let's see.
Stan,
Five is sort of the catch-all permission for the agencies to, essentially do their statutory responsibilities. Then we're not trying to stop the things that they are responsible for now, but the things that are common, we're trying to pull them together.
I'd loan you my glasses, but then I wouldn't be able to see you. So,
and I don't have reading glasses.
I'm happy to do a two-paragraph, a sentence in each one if that would be useful.
See, that's the kind of cooperation we have with the department.
Thank you.
So 6 is the one that's about investigations. The other,
That's 50-12-6.
yes, on page 8. 5012-4 on page 7 is about the planning for a streamlined annual review and annual inspection. I know there's been some debate in the committee about whether the periodic inspections can be announced or not, or scheduled or not. There's a fair debate around that one. Obviously you catch people in their normal behavior if they're not scheduled, but there are also some things that some of that also happens sort of with a general sense that it'll be a particular month, 12 months after it happened the time before. I want to say loudly, as Ron did, that no one's trying to stop any of the intense interest in investigations for kids' safety and trying to help resolve, the huge management issues that an understaffed DFACS has to take care of 9,000 kids. And it's growing. It used to be 5,000 or 6,000. It was 14, came down to the 6 ranges, back up to 9 now. And that takes a lot of effort to keep up with.
All right, Stan, I think this is helpful, and I want to say to Together Georgia that thank you very much on behalf of the committee. Thank you very much for listening to our request to you all to provide specific language requirements. This is it. It's nice to talk about the abstract ideas, but ultimately, as a legislative body, we have to be able to translate that into language that becomes either law or rules, or, for our purposes, a recommendation. And so I very much appreciate your efforts in doing that. And what I would like to do is, and I'll talk with members of the commission later on, the committee later on, is I would like to try to have a couple of us sit down with some of the agency heads and Stan maybe or Ron, and just have an informal discussion about this particular language and modifications, and then have that come back to the committee at our next meeting. And any of the members are welcome to attend, but I'll try to schedule a meeting where we can all sit together in a room at a table and work through this language after we have time to review it and digest it. But I'll try to set that up with you via email.
Okay.
Or if we get a consensus at the end of the meeting, we'll do that then.
Mr. Chairman, I would say, back to Chairman Willard's question, if you look on page 5, this is just an example, but we've added language to the current power to regulate child placement agencies, child care institutions, and maternity homes. The first 2 A and B paragraphs that are not underlined, that's the existing law. It is pretty general. So, it affords some room for doing a lot of things administratively.
Thank you.
Thank you.
Any questions from the committee? All right. I was moving through the committee, asking individual members if they were getting their questions answered, and I want to continue with that. Chairman Houston, you had raised a couple of issues before. Do you have any follow-up questions or concerns that you wanted to raise in particular?
Well, are you talking about the shampoo? I think that's enough about the shampoo. No, but there's one thing I can't understand, and it's about the wind-shaped homes and homes, youth homes. How, we want them to have more defects to refer more children to, say, wind-shaped homes, but yet you would refer a child there, And then the way I look at this Kenny A settlement thing, they would have to move that child out within a certain period of time. And to me, it would be devastating to a child to have been in a home like that, and then you move them out with some relative that they don't even know, and just upset the whole thing. Just like it bothers me a lot of times that when we have children placed in youth homes that are doing a lot of curricular activities and playing ball and are real involved, and then all of a sudden some relative that shows up that they don't even know, and they're crying and don't want to leave, and it's just sad to me. And I'm not so sure sometimes that's the best thing. And I thought several years ago, didn't we pass a law, Mary Margaret, that you had a certain amount of time to find a relative? What? I don't remember. We passed so many laws I don't remember. But what? Tell me what it said.
It was 30 or 90 days, but there was some statutory guideline. You have to act in the front end about finding family.
I don't know if we're following that or whatever happened about that rule, but there was a rule. But it's hard to see a child that's on a football team being placed with some relative across the state that they didn't even know. And I'm not saying football is that important, but the more extracurricular activities you can get teenage boys in, I feel like the better off they are. And I hope we'll review that law and see how long we have in Georgia to find permanent placement for somebody.
Chairman Weldon, you wouldn't know anything about boys in football, would you?
Well, I just what I learned from you, Mr. Chairman.
He has two that are playing right now. So I guess the question would be from agency personnel is Chairman Houston's point about I don't know the frequency in which it occurs, but where a child has been placed into a private care facility and then has to be taken out of that facility because a relative is found, and then what's the time frame for making that determination so that you don't have someone just removed after they've established those relationships.
And I do see the point of the law, but I think we've got to take each one of these children into these cases individually. And when we see a child that's 13 years old, that's well adjusted, his grades have come up, he's in extracurricular activities, and he doesn't want to leave that place, I just don't think we ought to force him.
Chairman Weldon.
I think we got to do what's best for the child. And I know you have to do what the law says, but sometimes it's just really sad.
Chairman Weldon.
Thank you, Mr. Chairman. To the point that Chairman Houston is making, I believe that between parents in a divorce or a child custody dispute, I believe the standard is the best interest of the child. I believe there's a Supreme Court case that echoed that or set that standard not too awful long ago. And I was wondering how that standard might fare with the comments that have been made in the certainly there are third parties that would be better parents than some of the natural biological parents that I've seen, and I wondered what the comment of the department might be on
that. Okay. Good morning. I'm Diane Kelly. I'm the Foster Care Services Director. And I just wanted to share that we had a very positive meeting with WinShape. We went out to the WinShape homes on Friday. Had a really good meeting trying to understand what their program, how their program operates, helping them to understand DFACS's objectives, which is to get children out of foster care and into a permanent family as quickly as possible. I think one of the fundamental things that we understood on both sides from that meeting is that there's a difference between placement and permanency. And when children come into foster care, we are trying to identify a temporary placement for them, which is a CPA or CCI or DFACS foster home. And then we're also, working on looking for relatives to be a temporary placement while we work with the birth family towards permanency. And the difference with WinShape is they are in a category of being a temporary placement provider because they have a CCI. But what they actually offer is permanency. They offer a permanency placement, not a placement, but a permanency, a forever home. And so the disconnect is when children are coming into care, we need a temporary place for them to go so that we can work with their families in order to ultimately, hopefully, return them back home. The majority of kids in foster care do return back to their families. And so we've got to figure out how to figure out that dividing line between placement and permanency as it relates to the wind-shaped homes. And we came up with a couple of ideas, one of which is to do a matching meeting, because we do have children that are in foster care that have exhausted their family resources that need a permanent home. And so sitting with our counties and with WindShape at the table and presenting to them some of these cases where these children actually might fit the WindShape model, I think makes sense, and that we probably would be able to get somewhere with that. But ultimately, I think that the issue that WindShape is faced with is that they are in a category of being a placement, a temporary placement provider, but they're offering a permanency solution, and so it's just really difficult to kind of navigate that. But again, as I said, our meeting was very positive, and we walked away with a couple of to-dos that I think really could move us forward without even have to do any legislation or anything special. This is just an opportunity to sit down with each other across from the table and talk through what each of our goals are and to figure out a good solution, and I think we've definitely started that process.
Ms. Kelly, what is the turnaround in terms of going from temporary to permanency? What is the period of time in which
we try to get kids home within 12 months?
Okay.
And relative diligent searches for relatives starts immediately and should continue throughout the case. So there should never be a time where we stop looking for relatives until we achieve permanency or make some determination that that is no longer any viable relatives out there. We should continue to look, and we do.
Representative Tanner. I'll come back.
Thank you, Mr. Chairman. Chairman Houston actually hit on really the reason I asked the question earlier about the Kenny A standard being looked at across the state if we were monitoring those statistics, because specifically starting I think at number 7 on the Kenny A performance grid, if I understand it correctly, is really going to her point, is that we do not want to continue to move children from place to place, and that's a concern I've had in my working in my background before, is children get happy in a place, they get happy in a certain foster home, and then they're moved, and then trying to terminate parental rights and move the child into an adoptive home more quicker is, I think, very important. So it seems like, unless I'm missing the point of the Kenny A performance grid starting at number 7 and several down, is actually trying to do that, trying to make a decision more quickly if we're going to be able to return the child to a parent, if there's another relative that can take the child, placing them in a wind-shaped home, getting them in more of a permanent situation quicker. Am I correct that that's the goal of this?
Do you want to speak to that?
Ms. Gibson, that mic is on right there if you want to use that one.
Okay. You are correct that we have 60 days in order to do an official look for relatives, for parents, and as Diane indicated, not only do we do that within the first 60 days, it's mandated by the consent decree, but it's throughout the life of that case that we must look for children until the parents' rights have been delinquished. So that is something that we are trying to do on a regular basis throughout the life of the case. You don't stop after that initial search for relatives and for their parents, but you keep looking until their rights have been terminated.
And the reason I ask that, just from some very personal examples that I've been involved in, is where parents have a foster child in their home from the time they're babies to 2, 3 years old, and the process takes so long to get those parental rights terminated so that they can adopt that child, and they're living in that constant fear of the child being taken away. And I think the best interest of the child is try to get permanency as quick as possible, and I think that's what Chairman Houston was hitting on. So, and you all know that, but I wanted to see statistically in my area how we rank with DeKalb and Fulton and other places across the state in those specific categories, starting at number 7, where we're able to get a permanent placement or find the parents or place them in an adoptive situation, and what percentage that was in each of those categories.
Okay.
Thank you.
Well, Representative Tanner, you really lit them up now. Thank you, Representative. Chairman Houston.
I really have problems when you say you don't ever stop looking for that relative. If that relative really cared about that child, it looks like they would have come forth and spoken up for the child. I can't imagine just searching for some relative that didn't even know the child and putting the child with somebody and he'd been left in the custody of the state for a couple of years, and then all of a sudden he appears. I just can't imagine them not caring enough about the child if they were a relative. I'm sorry. It's just a difference of opinion. And I'm sure you feel the same way, too, but you can't say it.
Well, sometimes that has to do with the paternal relatives. A lot of times we see that we've not been able to locate the father and establish paternity with the father. And what I have seen in working in this job for the last 16 years is that a lot of the times that they are not even aware that their child exists. And as we continue to search, we find those paternal relatives and they want to step forward.
Well, I can understand that, but when you just say keep on and on, if the child's happy,
I think it would be helpful to know what the percentages across, regardless of any particular district or region. What is the turnaround? What's the length of time it takes DFACS or the agencies to locate a biological parent or other relative that might be interested in adopting? What time frame that is from a practical? You say it's ongoing, but we ought to have some kind of average or sense of how long that takes. I think that would be helpful to know for the committee. Chairman Weldon.
I'm going to withdraw my question.
All right. Representative Oliver.
This is very helpful discussion. You do know from your data what percentage of children are returned home within 30 days. You know from your data what percentage of children are returned home within 90 days and don't ever come back into the system, and that's a substantial number of children. The number I'd like to know is what percentage of your children are you in violation of the federal law that between 15 and 22 months you are legally obligated to proceed to terminate parental rights if you have not returned the child from home. That is the federal law time frame. And I have always been concerned that, and you tell me if I'm wrong about this, that Georgia is not in compliance in terms of that 15 to 22 month period. But you have all that data, and I think all that data would be very helpful to this committee. We also discussed at this table, Mr. Chairman, 2 meetings ago, that Winship passed a statute specifically to assist Winship in its permanency definition under a guardianship statute around 2003. You had a good legislative lobbyist and effort, and the governor was with you, and why didn't that work? That's my question. Or are you around?
Well, I'm not sure it didn't work. I think the issue that we're faced with, again, is the difference between placement and permanency, and the fact that the top options for permanency are return to the family, adoption. It used to be a relative guardianship and then guardianship, and the permanency that WinShape is offering is it's the least of the tier, and so we have to go through everything else before we can make a decision to seek permanency with WinShape. And so what I'm suggesting based on our meeting on Friday is we're there for a number of kids, and we need to sit down with WinShape and present those cases to them so that they will have an opportunity to say whether or not these are young people that might be a match for their programs or not.
Chairman House.
One quick thing. I got a letter several years ago that one of the counties I represented had the highest, I'm not sure exactly what you call it. You place the child back with their parents and then they come back into the system. What term do you use for that?
Reentry.
Okay. Reentry back into the system. That my county, one of the counties I represented, had
a high rate.
High rate.
Okay.
Can you give us the rates by counties of the children that you place back with the parents and they come back in the system?
Yes.
And
apparently that's information that anybody can get, because
yes,
I just don't know how to pull it up.
That's information that we regularly track, so we can definitely get that for you.
All right, thank you.
Going back to Representative Oliver's question, what is the time? She's referring to a federal law that's I understand to specify a time frame by which you either need to have found the parents or you need to undertake termination of parental rights. Am I understanding you correctly, Representative?
Yes.
What is it? Does anyone know that time frame?
15 of the last 22 months. Thank you.
Right.
Okay.
She's in.
15 of the last 22.
So,
unless we have compelling reasons.
What is that? I don't think does the federal law say unless we have compelling reasons?
Right. There's 3 exceptions to it.
would you mind going to the microphone? Thank you. We'd like to know who you are and all that wonderful information.
My name is Vivian Egan, and I am the in-house counsel for DFACS with the Office of General Counsel. And it's 15 of the last 22 months the child's been in care. And there are 3 exceptions. One is a compelling reason. The other one is essentially that DFACS has not provided the services necessary for reunification. And to save me, I can't think of the third one right now.
So am I understanding it correctly that there is a time frame by which which the state is responsible for either finding a home with a relative using the priority system that Ms. Kelly was just outlining, or terminating parental rights and allowing the child to be adopted or a guardianship to be established?
We have to file a petition or join someone else who has filed a petition to terminate if the child has been in care for 15 of the last 22 months. And one of the exceptions does not apply.
And from Representative Oliver's further question earlier, it seemed that there's a question of whether we are complying with that turnaround time.
I know that there is some data on that in Shines. I'm not familiar with it.
Okay, so we will get that. Okay. Representative Tanner?
Just, I think to draw your attention to the Kenny A performance grid, I believe number 15 is the one that would relate to that, if I'm not mistaken. And as you can see that the goal is 95%, and then it says at least 80% will have one of those 2 things done. So it seems clear based on that we're not at 100% if that's what the federal law requires.
And that's for DeKalb and Fulton. I think we want to see it across the state.
Yes, but number, and correct me if I'm wrong, but I think that number 15 goes to that point. Thank you.
Okay, you were affirmed, Representative. Representative Chandler.
Help me understand what you mean by 15 of the last 22 months, please.
You take the last 22 months of the child's life, the most recent 22 months of the child's life, and if 15 of those have been spent in care, then we're supposed to file the termination petition or join someone else who's done so.
Go ahead, Chairman.
Does this SHINE program tell you that they've been there 15 months, or how do you know? I mean, I would think with all who indicates what the 15 months is up?
You track the child in the system. You know when the child came into care, and
I know, but I would have to count back. I mean, I didn't know if it was computerized.
It should be computerized.
And it says 15 months out. We got to do something.
And they test that. Has the child spent 15 of the last 22 months in
care?
But
it beeps on that he's been in there 15 months, so you know you do something right then.
I don't know how the alert's set up. I'm the law part and not the data part.
Okay, I didn't.
I'm not sure if there's an alert or not in Shine, so we can check and see.
I didn't know, you know, it'd be hard to go back with, you got the caseload some of y'all have, and 15 months.
All right.
In and out.
We have about, I'd like to spend the last 20 minutes, if you will, of our time together. I know how much I enjoy everyone's company, and we could just be here all day long, but to be respectful of everyone's time. We have about 20 minutes left. We may take a little bit longer, we may not. But I'd like to run through some of the recommendations that have come consolidated by the committee at this point. These are just draft ideas. And this begins on your package that you have licensing and inspection of child well providers, September 8, 2014 committee members. You have the draft from today. It should be stapled to your package. There are 2 pages of those, 12, and I want to go through them. And as we go through them, if Together Georgia and others will be just available to come up to the microphone and comment, let's try to move through them quickly. And then into where we have overlap or some agreement on them, let's identify them and say, let's try to work on where we can work on to solidify some language in terms of a recommendation, and then where we have some serious problems where there's that we can't build cohesion, I want to flag those as well. Number one is I think that we need to research about database technology, and I think this is also covered in one of the other comments here. So I think we're talking about centralized database. We've talked about Georgia Score as being that maybe a warehouse of information by which agencies can look across the board, interagency and intra-agency, to obtain information. Does anyone in the committee want to elaborate on that particular comment or suggestion? Okay. Now, those from the agencies, are we coalescing around an idea that we need to look at some kind of centralized database for all the inspection reports to be uploaded into, so that across the board you can look and see how compliance is being monitored and what the results of inspections, what those results are? Okay. All right. We'll develop that out a little bit further in terms of language. Set number 2 is the rules need to be more age appropriate. Rules that apply to 3-year-olds can't apply to teenagers. We had a good discussion, I think, and I don't want to focus on the shampoo, but I think Representative Tanner had made the point that there are certain lists of household items that can be purchased, and Representative Tanner has, oh, there he is, okay. I was boring him, I guess. He's not sat back. But Representative Tanner had brought up, and correct me if I'm wrong, Representative, but you had brought up the point about that there are materials or things that you could purchase that the care providers can have or the CCIs can have that would not likely result in any harm to the children. So it says that keep out of reach to children label on it. And I think the comment here is, do we need to modify the rules? Do we need to look at providing some level of normalcy in a child care provider, a CPA's home, or in the foster home, or in the CCI? And is there a way that we can achieve that, or do we already have the rules in place that allow us to do that, and we just have some isolated incidences? And Representative Tanner, I've got your light on, so go ahead.
Well, I think when you and I talked, one of the concerns I had is I wanted to be careful as a legislative body that we didn't recommend that we take away a rule that, and then a year from now we hear that a situation occurred where a child was injured as a result of that, and that we're not, I don't think the rule's saying that they cannot have any shampoo out for the child. I think it just is specific that it has to be one of the shampoos that's not harmful to children if they ingest it. So even having run a detention facility in a jail, which I know this is different, but we also had limited type of items that we would allow to be out, and these were dealing with adults because sometimes people do things they shouldn't do. So that was my point, is I think that we're not saying now that there can be no shampoo out. It's just that there's an approved list of shampoos that they can purchase for that home. And sitting on the board of one of these homes, I can say that's never caused any issue for us. There's a list of items that we can purchase. We purchase those items. It doesn't really cost any more money. It's never been an issue. So I just want to be careful that we don't get out in the weeds so far with our recommendations that we tie the agency's hands to do their job, and then we put a child at risk. That was my only point.
Good point.
Okay. Any other comments from the committee? Thank you, Representative. I appreciate that insight. Any comments from the agency on this point? Is there anything that we need to tweak in this regard, or do we think that the regulations are sufficient as they are?
I think we can look at the regulation and how it's being enforced without really doing a legislative change to it.
Okay, Ms. Winstead, thank you.
And hit on the things that Representative Tanner's talking about, because basically it's really not so much the difference between a 3-year-old and a teenager. It's the behaviors of the teenager. You unfortunately do have teenagers that have suicidal tendencies and can use certain products inappropriately. So we would want to keep that safety piece intact.
Mm-hmm. Thank you, Ms. Winstead. All right, now number 3 was a centralized database. I think this, again, we're talking about trying to create that level of communication technology-wise. Number 4 is we should take into account a different category of institutions like wind-shaped homes. We had a really good discussion this morning. I think we started our meetings with talking about this, and today has been a very good discussion of that. I think there needs to be some more consideration as to how that can be approached, mindful of that we don't want to steer clear of a blank check. I don't think that anyone is talking about a blank check here, but there needs to be some. I think there's a desire to provide some level of reward or incentive for. It doesn't matter if it's WindShape or anyone, but if a CPA is providing exceptional care and has a good track record, I think that needs to be rewarded in some way to incentivize those that have good track records to be to function without too much of regulatory oversight. But that's just a balance. It's a policy question and a balance. So, any comments on this particular item, number 4?
Are you speaking about number 4 or number 11?
Number 4, it says we should take into account different categories of institutions like wind-shaped homes.
I think that's more outside of the CCI, CPA, but not the property incentive piece.
Yes, I'm talking. Yes, I'm talking about incentivizing through fewer inspections, perhaps, or changing how the regulatory treatment of them. That's what I'm speaking to. The incentives on 11, I think, tie into this, but those were financial incentives.
Yeah, I think for that one, what would have to be, I think the additional information we would need was what was requested of WindShape and places like that before, of what specifically would be different from a foster home, a CCI, and WindShape. What areas do they see as needing to be revised?
Okay, and there may need to be some discussion about should there be a third licensing category.
Right. Do they fit in foster as being a foster home, and if so or if not, why not? And do they fit into being a CCI, and if not, why not?
Yes, Ms. Kelly, please.
Even if you did change it into a new category for WindShape, you'd still run into the issue with permanency placement, because that doesn't change the hierarchy of how we make permanency decisions. So they could be, monitored as, some hybrid CCI, CPA, but that still wouldn't address their lack of referrals, because that issue would still remain. So I just wanted to put that out there.
By lack of referrals, Ms. Kelly, you're referring to just contracting with DFACs through OPM to take on.
They could contract with us, but they are a permanency resource, not a placement resource. So when we're contracting with providers, we're looking for placement resources.
And those are temporary placements.
Right.
So temporary placements so that you get the child out of the problem situation
while we
into
can
a
work
stable
on,
environment.
correct.
So you can prosecute or look for parents or a more permanent home.
Correct.
Okay.
Correct.
Okay. All right. No, it's a very good point. Mr. Scoggie.
I was just going to suggest that to Diane's point, if there is a small group of folks we're talking about kids, but those that Representative Oliver is talking about come into that 15 months of placement, for them to have WinShape be an opportunity or a program like WinShape would be fantastic, even if it was just 4 or 5 a year. So, that's to the point that everybody's making here. So I think there's a placement. Also, the fact that they are only servicing such a small group of state children, they shouldn't be under some of the same burdens of these other CCIs and CBAs that have almost all, if not all, state children. So that'd be my opinion.
Yeah, I think there's an inherent tension. What we're hearing on the committee is there's an inherent tension between DFACS needing to place, or DJJ needing to place a child immediately, and once placed in a WinShape home or CCI, then there's the issue of the child becoming attached to that home and then being removed from that home. So, it's, in some ways, it's a wonderful problem to have, that it's a tribute to the organization doing such a fine job that children want to remain there. But then it does go to the policy question of the rights of relatives, biological parents that may not know about the child. You get into an issue of severing those rights, the familial rights that are inherent and important in our society. So I think there's some tension there that we're just going to have to navigate through and see what resolutions we can come up with or recommendations we come up with. Number 5 is dealing with this is an appeal issue that we were dealing with before. And I know the agency provided very quickly provided a sheet to us on appeal processes titled HR 1723, Appeals Process Efficiency and Impartiality. This outlines the Department of Human Services appeal process, and I think that we stumbled across a interesting appeal process that was new to me. From our discussion with Ms. Winstead and RCC last meeting. If someone from the department would like to talk about it, I think the mindset of some of the committee members was, shouldn't we just follow the Administrative Procedure Act and have this go directly into the ALJ process, as opposed, maybe have the repudiation process as a step before you get to the ALJ, but once you get to the ALJ has rendered a ruling, that be the final decision, and that final decision then can be appealed to Superior Court, just as it is with most agencies in the state. Would anyone like to speak on that from the agencies in that process? Ms. Carr-Crosby? Yes. And am I saying that correctly?
Yes.
Okay.
Yes. Well, sir, with the information that we did provide, it is my opinion that, of course, when I mentioned at last session that some cases we do lose on appeal, agency review appeal, and some we win. So I think you would still have the same issue in that sometimes providers will still be dissatisfied with that decision, even if it's the final decision. So I don't know if that's going to just solve all the issues.
I think the idea was it does seem very odd to me that you would go through. I like the repudiation. Am I saying that right? The repudiation process? Refutation process? Okay, the refutation process, and I apologize, but the refutation process gave a window of opportunity for both the provider and the representatives from RCC to talk and say, okay, is there a problem? Can we fix this quickly? It's almost like a mediation process in a way in my mind. And then if you couldn't, resolve it, then you may, and that deals with, I think that deals with citations.
Yes, sir.
Okay. And then you get into other issues where you may be terminating the license or a more heavier appeal.
Where a sanction is actually imposed.
Sanctions imposed. Then you get to the process of going through the agency and then to the ALJ, then it goes back to the commissioner for a final
review.
Review, and that just seems odd to me that it goes to the it goes to the administrative Office of Administrative Hearings, and then comes back to the agency for review before you can get to the Superior Court. It seemed like it was an odd step. To my mind, it would seem that the agency needs to resolve that issue through the ALJ process, either settle it, resolve it, or hear it and have a decision made, and let that be the final decision. But that was just a thought. Representative Chairman Willard.
Thank you, Mr. Chairman. Because you and I had discussions about this. Very much so as to a property right. If you have the potential of loss or suspension of your license, to me that is something that should be determined by an independent third party. Mm-hmm. And out of that determination, either party, the agency or the license holder, would have a right of appeal, depending what they want to the Superior Court, as a writ of certiorari to have the record reviewed to see if the administrative law judge, ALJ, has correctly followed the law. It just, why would we go back to the director who's already, in effect, through his department, made a position?
Well, that's not totally the case. We do follow the Georgia Administrative Procedure Act, and we're entitled to the hearings, and initial decision is made by the agency. It just so happens that we do contract out that part of the process to ALJs at the Office of State Administrative Hearings, and other state agencies do the same. As a matter of fact, OSA, there were about 50,000 cases filed with OSA with other state agencies or from other state agencies. So it is part of a process, and we actually, with the initial decision, as a matter of time and cost to the agency, we felt that is a better way to go as far as having an independent body to hear the initial case. But then it does come back as required or as allowed by the APA. So I don't know what further I could say on that issue.
Why don't you may suggest this is get us a copy of your written policy on this and see how the thing actually melds together with the rights of the parties.
Okay. Written policy on what, sir?
This procedure that you have that speaks of the review level within the agency, the right of appeal of a decision by a license holder past the review level going up. Do you have written policy on that?
I think it's
actually by statute as well as in our rules and regulations.
It is. Okay.
You provided a lot of the committee members just received it today. So
I'm sorry. Yeah.
I didn't see it.
But it is based upon statutory authority. 5013(1).
Okay. Let us look at that, and then I think that the lawyers on this committee, of which there are many, will I'm sure have suggestions or comments about that.
Sure.
Especially our Chairman Willard. I think you will have some more to say on that. We'll look at it. We'll look at it and get back to you. Thank you very much.
Thank you.
Going on to item 6, this is a suggestion on trying to create an easier way to score and rank. We had noted earlier comments and written and verbal that indicated that the public could be misled into thinking that a particular facility was not doing a good job because the citations are published, but there's no reflection of how well this entity is doing, and that could dissuade people from either entering the system, becoming a foster family, or establishing a new home, or those that are private providers from being a part of the system in terms of the ranking. So this 6 goes to, can we come up with a formula by which we can do some grading of the child care providers, and put that as a part of the Georgia score so that the public has ready access to it, so that, yes, we understand there may be violations from time to time, citations, that some may be much more meaningful than others. We heard from Department of Community Health, I believe, it talked about the graduated rankings of their inspection reports when it comes to checking the kitchen. food being left out is more likely to result in someone becoming sick and ill than it is maybe how the knives are placed. There may be degrees in which some of these policies have a higher protection value to the child versus others. So just something to think about in there, looking at the grading system. Any comments or questions about item number 6 from members, from anyone, actually? Ms. Winstead.
We'd be willing, of course, to look at it, but some of the things that I want to make sure everybody's aware of, each rule does currently have a score per se, or a rating by a letter grade. So, I mean, perhaps it's more of a need for the general public looking at the website to have a cover sheet to that website that explains what the citation scores mean, like what it means for it to be an A level or B level or C level or on up. It would be a greater undertaking, of course, to figure out an actual scoring system and weighting the different rules. That would take some research, finding out if there's other states who have something like that.
Let's say, for example, that someone goes to Georgia Score that's interested in looking publicly at a particular child care provider, a CPA, and wants to see how they're doing. And I think we had one that OPM has terminated the contract on. Having an overall rating, an A, B, or C, would be easy for the public to identify, understanding that rating, and having it be cumulative in terms of across the agencies, so that DJJ, if they have children that are placed with a particular CPA and they are scoring well for DJJ, that is integrated into an ultimate score across the board, so that if RCC is looking at them and they're doing a good job with their paperwork, DJJ is in their inspections, they see that they're doing a good job with protecting the child, but also managing the certain I've forgotten the name of the federal rule that you have to, what was it? PREA. Then those things need to be computed and consolidated to one overall score, and then trying to utilize, and I think this goes to trying to utilize that. I think this goes to the next topic of number 7, trying to utilize those scores as a basis by which you determine the number of annual inspections that occur, or the number of inspections that would occur, to reduce those numbers for those that are performing well. I think that goes to 6 and 7, and it actually may go also to 8. So this is kind of developing a regulatory rewards system by which those that are constantly producing and protecting children and providing excellent care at a high level, an A level, that those agencies have a little bit less frequency in terms of their inspections. So I think that's what these are going towards, 6, 7, 8, and 9 perhaps. We have a comment from Representative Tanner. Oh, sorry. Go ahead,
What I wanted to ask about is, I've got to leave, I need your permission, please, Mr. Chairman, but I would like to maintain the same file I have here, so I put my name on it, so you can have it continue that way.
Yes, sir, we'll do that way. I think Ms. Susie will take care of that for you. Okay. Yes, sir.
Yeah, Mr. Chairman, thank you. It sounds like this recommendation would be very similar to the way environmental health inspects kitchens, where they have a top score, they get a A, B, C, or a grade, and then the fine print explains what those are. But one point I think we need to add to this is, I think it's important that the agency also maintains the website on a timely basis, so that the information that's on there is up to date. And if for some reason you fall behind and not able to do that, then take it down temporarily, because I do think it's important for donors looking to give their financial resources to these homes that that information is accurate if we're going to put it on the website. So I would ask, Mr. Chairman, that we, in this consideration of your suggestion, that we also make the recommendation that the website be maintained on a timely basis.
I think that's really good, a really good point. You're trying to incentivize people getting into the system. You're also trying to incentivize people that are donating private dollars to this. The only measure that they're going to have, unless they do an exceptional amount of due diligence, is going to be through this scoring mechanism. Certainly you can get a flavor of it from Georgia Score, but we're trying to make it a little bit simpler. It won't be simpler for us, the state, but it would be simpler for the viewing public to identify the information and refer to the information. And I think that in 7, this attempt here at 7 was to try to hasten that review process and getting the information posted, setting up a very quick review and appeal process so that that scores weren't altered if they were being appealed, or if scores were altered, that they would be done in an appropriate time frame. And this goes back to the Kenny A information that we received from Ms. Gibson, talking about trying to hasten reviews within 30 days. So that does tie in fairly neatly with Representative Tanner's comment about trying to get this posted quickly. Ms. Winstead, did you have a comment?
Yeah, I just still want to caution to make sure that it's understood that the difficulty would be in weighing a facility that, let's say, they had only one supervision citation, but it was a serious one that resulted in injury or harm to a child, versus an agency that didn't have a citation that rose to that level, but had a lot of citations of paperwork issues that, if allowed to continue, could eventually lead to a problem. So weighing those in which score should be higher, which should be a 90, the one that only had one citation, or the one that's kind of, done pretty well all year, didn't have any citations that really rose to that level. So that's the part that would be difficult in a scoring system versus scoring each citation, which we currently do.
I think that it's just going to be something. I hear what you're saying, but I think that's why you wait. You go through a process, and I think it would be frankly a rulemaking process by which you would actually go through and allow members of the public to look at rules and how you're going to weight this scoring system so that it's public and it's very well known to the child care providers. But I don't disagree with you at all that a series of administrative problems can show a lack of attention to those problems, and some of those problems may result in something more harmful happening to a child, just because you're demonstrating a lack of oversight within your agency. So I think that the weighting schedule, I don't have a recipe for it. I'm just coming up with the concept and the idea, and suggesting that may need to be looked at and then something put together. Mr. Scoggie.
I just want to offer up, several years ago when Georgia Score did their performance-based contracting, it's been under a series of conversations with the department and providers. Perhaps a similar type of workforce ad hoc committee or something could be formed to do just what you're suggesting with RCC.
Okay. I don't want to downplay that this would be a fairly enormous endeavor. I mean, just looking at the RBWO booklet alone is daunting. Translating that into some meaningful scoring method will not be easy. I'm not suggesting that. Okay, good. Well, see, then some of that's done. Then we're well on our way then.
It's the combining, and I think Carol is concerned. I think what Ms. Winstead is concerned about is the combining of the DJJ OPM and RCC scoring to make one score. But OPM currently has a scoring system that we use to weigh providers, which is what Mr. Scroggy is speaking to. But I think it's the combining to create one score for that one provider collectively is the undertaking.
Thank you, Ms. Stokes-Bryan. I think that there's Ms. Kelly as well. I think what we may not get to that point, but what we I think what we do want to see is an easier way by which the public can view those scores from each of the different agencies and understand what those scores mean, and then drill down if they want to. But having that scorecard and including DJJ and including DCH and having, or not DCH, what is the D, is it? Public health, is it public health? DPH, so DPH, right. And having that all listed on one scorecard may be helpful. I would think it would be helpful to have an ultimate overall score, but what the importance of the scorecard in my mind does two things. One, it communicates to the public an overall understanding of whether a child care provider is doing the job. It communicates that to the agencies themselves, so that one, the public knows where the children are, what conditions they're in, and creates that civic oversight that can be there, but also allows the department to incentivize those that are doing well. So if you're doing well, then how can we translate that score into some meaningful adjustments in the regulatory oversight? So that's the idea there. I think that those we talked about, that's outlined in 6, 7, 8, and 9. And then in 10, we talk about a central database here. This goes to the idea of, I think Ms. Phelan and Chairman Houston also raised this issue of having, prediction analytics was, I think, the terminology used. And the idea of having a centralized database does not only allows for the communication across agencies and departments, but it also allows for what we're hoping to see is some measure of prediction analytics whereby you are achieving a red flag, if you will, if certain variables come up, certain issues arise on a regular basis, that then would allow the caseworker to see that. So across the board, if DFACS is looking at something, but DJJ has identified something with that particular child as well, that a red flag jumps up for the caseworker to immediately take action, because the progression of events is such that it would suggest that the child is in danger. And in that regard, the information would not only go back to the caseworker, but a supervisor. So there's someone to oversee to make sure that the caseworker is actually responding to these prediction analytics, and we're getting some positive response, so that a caseworker, burdened as they are, and even with the governor's proposal and putting in, I think, 100 new caseworkers into the system, I still think there's a need for that oversight by which a supervisor can call the caseworker and check, have you checked on this particular child? The software is raising a red flag that things are progressing in a manner that would not be beneficial to the safety of the child. So I think that was raised by Chairman Houston and some others in previous meetings. And Ms. Fielding, I think you had mentioned that y'all were looking at doing an RFP or an RFQ.
We're not quite there yet, but we are planning on instituting predictive analytics with our SHINE system and with our Child Protective Services first, and then we'll roll out to the other. We're just in sort of the exploration phase of this one.
I've lost Chairman Houston, but in her words, that's not quick enough, I think she would say. But I think that needs to be hastened, because I think that we need to know what those costs are. As a General Assembly, we need to know what those potential costs would be, and we'd like to know those costs by the upcoming session. We won't know them until you put out a request. Is that fair to say? Looking at my fellow members, I know that Representative Oliver has been on appropriations a lot longer than many of us, but would you like to comment on that?
You're talking about a predictive analytic on child abuse outcomes. You're not looking at predictive analytics on regulation or oversight or regulation or business.
Right. Okay. The first step would be predicting risk factors for children who may have come in contact with the agency before, or whose the allegations have certain sets of risk factors that we know have put a child at higher risk before.
We're going back and forth between the child-based oversight and the institutional-based oversight. And the predictive analytics is really relevant on the child-based oversight.
That's my understanding, yes. Representative Tanner? Okay. I just left you on just to chime in whenever you like. Number 11 deals with this was a topic that I tried to throw up, tax incentives to try to incentivize financially private individuals and corporations to donate to child care providers. And you'll see here the suggestion was looking at trying to get donations for our higher risk children. They have higher needs, higher financial costs from what I was understanding from our previous meetings. So I'd like for us to be thinking in those regards, what can we do to incentivize that money transferring from the private sector into assist children at the advanced level, the AWOs, MWOs, PSW. Did I get those right?
I'm not sure, not the P.
Not the P, okay. There was one that was, well, I think there was a category of children that fall into, that may have been a part of sexual exploitation, had high psychological impacts, or had some very severe medical needs that needed greater attention. I think Representative Oliver had touched on these before our last meeting. What was the acronym that's used for that level, that child level? That's why I've got the PSWO wrong.
That you can put SMWO.
SMWO. Okay. Was there any others that I missed? I did not put the baseline in there because this suggestion was geared towards trying to incentivize where we need money the most.
Yeah, we asked a question last time about how many children were in maximum watchful oversight facilities, which I consider the kind of deep end of the pool. And you had 444 child care institutions, 685 child placing agencies. Does that mean you add those numbers together to get the, right, that's what I thought.
You do, okay.
600, that's over 1,100 children out of the 8,000 or so are in the very intensive, the most intensive service provider entity.
Yes.
Well, that's a large number. That's a large population. That's a
very expensive.
So you're talking nearly 10% of the population. So, I think everyone gets the direction we're going. The idea there. Any comments about item number 11? Okay. All right, and then number 12, the last one on the list from the committee, and then I'm going to ask to adjourn our meeting. But the item 12 deals with, I think, one of the underlying questions that from I guess agency. We talked about it earlier in the meeting, and that's just whether or not there's an advantage to centralizing contracting and licensing and those questions. And I think we've heard from Together Georgia suggesting that there would be benefits in doing that. If there are, I think what we will do in a little subcommittee meeting, if you will, informal discussions, I think I'd like to explore that further and in detail with the agencies and let y'all mull over this idea, the language that Together Georgia has provided, and then let's try to talk that idea through with the full intent of if we can't agree, at least having an open debate of the subject at the next meeting, because I think that's a fundamental structural change. And Representative Oliver had put forward the idea that we kind of need to know where and Representative Willard had also said we kind of need to know where the governor's office is on that, and I'll try to do some homework on that to shed some light. Any other comments about the 12 suggestions or discussion topics from the committee? Committee members, if I have missed anything that you have thought was important or recommendation, would you please email that to me? And if I don't respond to your email, would you call me on my cell phone and figure out a way to knock me over the head? Some committee members had submitted other suggestions, and I apologize. I think I did not get all of them on this list. So to those members, I do apologize. We will refine this list a little bit for the next meeting. My goal is to try to have a list of recommendations for our next meeting to vote on. And again, I appreciate everyone's time. I know it's been a long morning. Thank you for your patience. With that, I'll call the meeting adjourned unless there's any comments from the committee. All right. We are adjourned. Thank you.